Hello and welcome to the Patient Educators Update, where we talk about patient education in a clinical environment. I'm Chuck Jones with Synergy Broadcast, and I'm pleased to welcome our expert guest, Fran London. Hi, Fran.
Hi, Chuck.
Fran is the patient education specialist at Phoenix Children's Hospital in Phoenix, Arizona, and she's also the author of the book, No Time to Teach, the source of so much of the inspiration on how to be a better patient educator. Here on the show. And Fran, we're going to take some stuff out of the book today, but we're going to respond to a question that popped up from a customer. And it was how to deal with nurses who don't think they have time to teach. And, no job I've ever had did everyone say they had plenty of time to do what they needed to do. There's always time pressure. So it makes you wonder what's the real issue. And it may be a combination of things, but here's some things that kind of came up out of our conversations. Some nurses may have no desire to teach. They may think their job is only just to do the medical stuff and that's it. Some may not know how to teach because it's not something that you're just naturally gifted at doing. Some people need to learn. Some are not sure where to start. Pardon me. Some don't see it as their responsibility. Some may not think the patients care or want to learn. I remember once talking to a registered dietitian who was just beat down by patients who just weren't interested in the advice and help she was trying to offer. And so I can appreciate that. Maybe there's no emphasis from administration. Maybe it's all of these things. I don't know. What are your thoughts?
Yeah, you put a lot out there, but I think they're all relevant and true.
Mm-hmm.
Probably the best way to attack this is to think about what really the priorities are and what the whole point is. Again, I go back to the first priority of being hospitalized is to have your life saved, mm-hmm. to be able to continue to live.
Right.
And then the next priority is going to be to regain or gain as much as possible functioning so that you can go back out into the world and live your life as well as you can. Mm-hmm. And if we look at the priority of the nurse as making sure that the patient can take care of himself after he leaves the hospital and continues whatever care is necessary to get better, or maintain, then that's the job of patient education. So patient education is indeed a very big priority in the hospital if indeed your priority is to improve health outcomes overall.
Yeah.
So then we have to restructure everything and say, okay, then if you're not finding time, what is the issue for you personally? And that may be any of those things that you mentioned. It may be that they don't know how, they don't know what, in which case we can work with that. Mm-hmm. We can figure out, what is this patient going to need in order to get better? What were they not functioning at very well before that now they need to come back? In the case of that registered dietitian that you talked about, the frustration of people not wanting to know, find out what the patient's priorities are. And if the patient want something that education will help achieve, then that's a motivator for patient education to be done.
Mm-hmm. Now, what would your advice be to, let's say, the chief nursing officer or the person who is in charge for nursing education when they run into this? Should it be something that they address one-on-one with the nurses that they know seem to have some of these issues, or should it be addressed in a class situation or, heaven forbid, an email?
Well, it really depends on what they're faced with. Mm-hmm. If it's a whole care area, a whole unit where the staff is not documenting education, they're getting low scores on evaluations in terms of patients getting home and not knowing what to do, then that would involve the entire group. And a good way to do that is to start with kind of a focus group to say, well, what is going on here? What are your challenges? And is it that the management does not support the importance of patient education, and that can be certainly adjusted? Is it that they don't have an easy way to document patient education? That can be adjusted. So you really have to find out what is going on and then address those issues one by one, the biggest ones first, until you have improvement in the entire area.
Yeah. Now, for those who want to learn, I think the two tools that you talk about the most, assessment and teach back, are pretty easy to teach and learn. And I would think that that's where you would want them to start, correct?
Those are the key skills. And actually, assessment and evaluation of understanding are very similar in that you're listening. You're finding out what the patient knows so that when you provide the teaching, you can be more specific, more appropriate, more individualized to what that learner needs and present it in a way that they can understand it so that it is more effective and you're more efficient. So you don't have to spend a lot of time teaching stuff that isn't necessary. You focus right on what is most important.
Yeah, and that was going to be my next question, because I absolutely understand the principles behind what you teach, and of course I've heard people say, well, we teach the same thing to everybody regardless, and that's a big way to waste time, isn't it?
Absolutely, because they might have experience and know some of this already, or they might think they know it and then ignore what you're saying because what you're saying is not consistent with what they already believe. So you really have to do some assessment to find out where they're at so you can avoid teaching stuff they already know, and that saves you a lot of time right up front. Or correct misunderstandings, which also saves you time because then the time you spend teaching, they will actually be listening.
Right. Okay. All right. All good advice. I apologize. My coughing from my cold is not fully gone away. So I think we're going to leave it right there. I think this is some good advice, and I think this is also a topic that we can touch on a couple more times, dig a little bit deeper and go down a couple of different paths on this, because I think this is some things that most hospitals will face at some time during the just the ongoing operations of the facility. So we'll look at this again. So thanks for this for the overview today. Why don't you tell folks where they can find you?
I have a blog at notimetoteach.com, and I'm on Twitter tweeting the research that's current in patient education at No Time to Teach.
Okay. And your book is available at Amazon and other booksellers in both ebook and paperback form. And for those that want to use it for in-service training, they can get a bulk discount from your publisher, Pritchett and Hull. And their website is p-h.com. And we'll have the links to all that stuff in the show notes. And then if you're interested in adding on to your patient education by providing nurses with additional tools, we strongly recommend video on demand. And you can contact us via our website at synergybroadcast.com to learn more about MMDS, the Medical Media Delivery System for video on demand patient education. So, Fran, thanks so much for the info today on how to help nurses that don't think they have time to teach. We will explore this in more detail because it just piggybacks so well with the title of the book. So, so thanks a lot. I'll talk to you next week.
Okay, bye, Chuck.
Okay, bye-bye.